25 years female complaining of pain in abdomen, mild pain, and diarrhea since 1 2 days. No fever, no vomiting. Just first episode. No any previous such episode before 5 6 months. Since 5 6 months. This is for the first time, and the probe is placed on left iliac fossa, and this is the descending colon. It is edematous in transverse view, and now we will take it the longitudinal view and look for this edematous descending colon and trace it further upward. This is the descending colon. It is edematous. Quite significant edema is present, and this wall has become quite smooth, so it is a feature of colitis. Could be initiation of ulcerative colitis. This in ulcerative colitis we see this kind of white band, 3 white band, which is edema of the wall of large colon. Still further, if we trace this large colon, here, now I am placing this probe in the epigastric region, upper abdomen, and will look for the transverse colon, and yes, this is the transverse colon. It is very difficult to localize transverse colon. Sorry, that was not transverse colon. This is the iliac loop. We will trace once again from the upper part of the ascending colon. This is ascending colon. It has become edematous, flower-like shape. This is upper end of ascending colon, and now going transversely towards the right side. Not able to trace the transverse colon. And it is difficult also. Now the probe is placed on the right side of the abdomen, right iliac fossa, and we will look for the edema of ascending colon. Here the probe is placed on right iliac fossa present. These are iliac vessel. This is right ovary. Again, the probe is placed on epigastric region, and we will move towards the right side near the upper part of the ascending colon. And yes, here this ascending colon and terminal part of the transverse colon is visualized. Yes, this. but still it is difficult to trace the transverse colon. Maybe it might not be inflamed also, edematous. That might be also the reason. And yes, here you can see very clearly the descending colon. But this edema is more in upper part of the descending colon, because here we can visualize very clearly the flower-like appearance. Here, and in lower part it is somewhat less edematous, and you have to take care that you should not apply too much of the pressure, otherwise this edematous ascending colon could become compressed. Now further, this is the descending colon lower end, and this here we are tracing, and this is the transverse colon. And further, this transverse colon is very difficult to trace, because bladder and all that structures come in between, and it is located posterior to the bladder. Further, we can visualize rectum if it is inflamed. Yes, this is rectum. And it is quite a little bit prominent, so there might be edema. That is the reason patient is having complaint of bleeding per rectum since 1-2 days. So this rectum, which we see somewhat easy to identify, it could be due to edema. A normal rectum also we can identify if this much bladder is full and uterus is behind the bladder, and we can make a good window to visualize this rectum. Could be acute colitis at present diagnosis. If such complaint persists chronically, then it becomes inflammatory bowel disease.